Well, good evening and welcome to our show tonight. It is one of those rare shows that we've had. It's been a while since we had a show in one of those Saturdays. You've been seeing us having shows on Wednesday, Thursday, and a little bit of Monday. But at the moment, we are restructuring our programming and more things are coming. And tonight, we are privileged to have the Vice President for the Kenya National Chamber of Commerce and Industry. And that is none other than Dr. Ruto, who is one of the sons of Baringo, who have made a difference, and they are holding one of the highest offices at the Kenya Chamber of Commerce. So karibu sana, and let's have fun as we learn more about business, the economy, and also surviving COVID at this difficult time of the global pandemic. Karibu sana. Daktari.
Oh, thank you very much.
Habari ya leo?
Niko sawa kabisa.
Karibu sana.
Yes, thank you.
Welcome to our studios. Yeah. And maybe we can get to know about you before we continue. Who is Dr. Ruto?
Okay, thank you very much, Mr. Komen.
Yeah.
Today I'm indeed honored to be in your studios. And I would like to say good evening to the viewers. And definitely we are very sorry to interfere with your dinner. And most likely for those ones who are planning to sleep early, to interfere with your bedrooms at this time. And knowing that this being a weekend, you have had a very busy week.
Yeah.
So thank you very much. I'm indeed honored to be in these studios of Baringo News. First, before even I introduce myself, I would like to appreciate your studios, world-class studios.
Asante sana.
I've done interviews nationally. I've also done interviews internationally. And looking at the studio here, it is of world-class standards.
Tunashukuru sana.
And as young people, you are doing fantastic things.
Thank
I'm
you.
seeing this studio and this media house
Asante.
going international
Asante
from the setup itself.
Thank you. Having such kind of kind words from a senior person like you, they're humbling. And funny enough, you're actually preempting. We were to organize kind of a launch of this unveiling of this studio. So you're already given them a sneak peek of what is cooking here.
Okay.
Asante
Okay, thank you.
So tell us about Dr. Ruto.
Okay. As you mentioned, and introduce myself, my name is Dr. Ruto K. Eric. I'm a medical doctor. I'm also the Kenya National Chamber of Commerce and Industries first vice president.
First vice president.
Yes. Equally, also I'm an healthcare entrepreneur. I've done it for the last 11 years.
Yeah.
I'm the chairman and the medical director of Real Group of Hospitals. And Real Hospital, our main hospital is in Elgeyo, and another main hospital is in Nairobi, in Utawala.
Nairobi, you've already moved, expanded to Nairobi.
Yes, we have 2 inpatient facilities, and we have 5 clinics, one in Kapsabet County, Nandi County, Kapsabet. We have one in the CBD of Elgeyo. We have Safaricom in-house clinic and another clinic at Kabarnet.
Oh,
thank you.
That's really impressive. And maybe there's something you've left out. Where do you come from?
Oh, okay, thank you. As you've mentioned earlier, I'm the son of the soil.
Yeah.
I come from Ravine sub-county, from Mumbere's Majmazuri ward, and specifically a village called Mumberes.
Mumberes.
Yes, it's one of the places that sometimes we see snow and we see ice. So it's if you've taken your chips, whether it is here in Ravine, in Kabarnet, or in Nairobi, or even Mombasa, we want to say that we were one of the proud suppliers of the highest quality of potatoes that comes from Timberwa. And sometimes actually we determine the price of potatoes nationally.
Interesting.
So that's where I come from.
Wow, that is quite comprehensive. And I think looking at your position as the vice president for the Chamber of Commerce, you already talked so much about your environment where you are in right now. You've gone into potato farming, and clearly you've given an opportunity for Baringo to market itself, and that is really impressive.
Actually, I've not gone into potato farming. I was born into potato farming. So it is. I think it was just by biological accident that I was born into the potato farming.
Well, so, I was just acknowledging the fact that you've just appreciated, or rather highlighted the fact that Baringo is one of the biggest producers of potatoes in Kenya.
Exactly.
Now, back to you. you've just indicated that you are a medical doctor. What area have you specialized in? Because you'll find pediatrics and all sorts of specialization within medical career. What have you specialized in?
Okay. I would say that I've specialized in two areas.
Yeah.
Currently, I'm an healthcare entrepreneur expert or consultant. But in terms of clinically, I'm an infectious disease specialist. And I think we are in the era of COVID. Yep. And that is the area where I specialized in my master's in medicine. And I practiced until 2016 when the natural calling came to be an healthcare entrepreneur consultant.
Well, yes. Talking about infectious diseases, I think you will come in handy tonight to maybe take us through what COVID is all about.
Yes.
Try and give us, or rather differentiate between the myths and the facts. But before we go into that, you've indicated that you are an entrepreneur in the health sector. Where did it start and how has it been up to where you are right now? You've indicated that you are present in almost 6 counties?
5 counties.
Uasin, Gishu, Nairobi, Baringo, Nandi,
yes.
And so 5 counties. How did it start and how has the journey been?
Okay. I would like to say that running a healthcare business is almost like a generic, like running any other business.
Yeah.
And maybe I can give you a sneak view of where I have been or what has led me to be where I am.
Yes.
Of course, it's a very big story. I'll give a summary. If I were to talk, we can talk the whole night.
We can spare that for another day, but you can just give a summary.
Until maybe you sleep. So what I would say is that my entrepreneurship skills started a long time ago, immediately after high school. One is that I didn't like, and I think maybe it was not in my genes, it was not in my blood, doing the manual farming. So when I came from high school, I'd saved some money. I think most of you know something. There's something called caution money.
Caution money.
Caution money, yeah?
Yeah.
By the time I was leaving high school in 1996, I had 1,200 with a few cents. I can't remember exactly.
Yeah.
And then I know the young people, if I mention 1,200,
it looks like peanuts.
It looks like peanuts.
Yeah.
But then it was good money.
Yeah.
Because I came home, the first thing that you find in your environment is farming. Because I was happy. My parents gave me a small portion. I did farm for the first 6 months.
Yeah.
Then after that, now I entered into business. I did a lot of business, selling food, fresh food. From here, I went to Marakwet, those areas of Ngambo. I went up to Nginyang.
When you say food, what kind of food?
That is mainly horticulture food. That is potatoes, vegetables, cabbages, fresh maize. I went to the whole of Western Kenya, to Bungoma. Every trading center in Western Kenya.
Wow.
If you start from Cheptulu, you're going to Mango, you're going to Shamahogo, you're going to Kibosha. I went to Kisumu, Kericho. The only part I didn't go is the Nairobi side. And I said one day I'll be there. And surely I was there. Then after that, of course, I went to university. I studied medicine. It took 5 years, an internship. After that, I came. And one of the key turning points in terms of, I think that blood in me in terms of doing business was still there. Of course, when at that time we were still lucky. That when you finish medicine, we were hired within 7 days.
Within 7 days.
From the time your name appears that you've passed, even before you get your certificate from the university. That time there was still a shortage. That was in the year 2003, November. I even remember that we were in November 9th is when we were posted. And I reported. I was posted on a Friday. I reported on Monday for internship. The first 3 months, I received a boom, which was good money. I never even entertained myself on that. I used to survive on basic needs. So I saved that money. And within 9 months, I was able to borrow a loan. And that time, when you're going to college, you board a bus and you count the number of people who boarded. And you see the conductor holding that money like this. So your mind always, as a young person, your mind is not thinking of many things. So you are busy counting how many people are in the bus, how much money. So you count and you say, this seems to be a lot of money. So of course we entered into the business. And as I think most of you are aware, it's a very tough business, matatu business. It actually
Wait,
taught me.
You entered into matatu business before?
No. When I qualified as a doctor,
Okay.
I said this is a side business. We had one of our mentors who was a specialist.
Yeah.
And he said, this is side business. He works from 8 to 5.
Yeah.
Then he monitors his things, of course, in the evenings. And he said it's a good business. So he met us. He said, you can buy a matatu. So immediately I borrowed a loan. That was one of the most painful things I ever did.
Which year was that?
That was in 2005 and 6.
And I must have, which route was the bus plying?
It was one of the, not even, it was a matatu, it was one of the busiest routes in this country.
Which one is it?
Elgeyo Kisumu.
Ah.
And you remember, you know the population there.
Yes.
The matatu goes after every 100 meters, it's stopping. So of course, I'm a doctor here, I'm working, a new doctor. Of course, I don't want to lose focus.
Yeah.
2 years running it, I said, no, this is not me. In fact, I never used to even see that matatu for 1 month.
And allow me to take you back.
Yes.
You just said it is one of the worst decisions that you made.
No, it's one of the, not worst, painful.
Painful.
Yes.
Could you just go into that pain?
Yes.
Somebody would be saving for some...
as when you qualify as a doctor,
the
expectations that you have for yourself.
Yeah.
That time, because of, I had a loan already that I'd borrowed for my salary, had a loan for the matatu itself.
Yeah.
And at the end of the month, at the beginning of the month, you've paid all your loans. At that time, that was in 2005-6. I was only remaining with 2,000 shillings. That is for food. That time I was newly married. Of course, you have to take care of a family.
Yeah.
So imagine dividing 2,000 shillings for a whole month. And I had to survive on it almost for a year.
Wow.
So it was one of the most. But anyway, it taught me how to do business. How was to do savings.
Was it profitable? Someone there could be saving some money.
I would say, and that is one of the things I want to tell the young people. I think one of the things is that that's why I was introducing myself in terms of doing business is a general aspects of doing business.
Yeah.
And that's how it comes from. Because the fact that I was able to succeed very, very fast when I came into the healthcare business. One, I'm a professional there.
Yeah.
Two, I have learned
your lessons before.
I have learned the ladders and the lessons before.
Yeah.
Because I've also seen my colleagues who are doctors and they come to start business and then they don't succeed.
Yep.
But having learned to do other things previously, I think made me to leap. So in 2009, that time I got a private practice license, whereby part-time. So that one I started my clinic then in 2009. And with that now, my commitment was there. It was 100%.
Wow.
In fact, the route from my house to the clinic, that is the only route I knew. And to the hospitals, nothing else. So my focus was 100%. And within a very short period of time, you are getting clients, they like your services, they are coming, you are available for them, you are giving them what they need. So within a short period of time, I'm having a huge clientele for admission. Insurance companies came to me and they told me, do you have an inpatient? I don't have. Can you even help us manage? Because there's something called management of inpatient. Can you help? I did that. So I saw an opportunity and I did open my facility. And before even I was registered, I'd already signed contracts with insurance companies.
Wow.
So 2013, we opened the hospital. And with that commitment, you have to give 101%. Any business, whether you are doing an hotel business, whether you are doing logistics business, whatever you do, even your business.
Yes.
When I leave here, you should not close the studio. Research, think about it, put all your time.
Wow.
And that is how we came to succeed in terms of offering services as Real Hospital. And I'm happy, especially people from around this region, they've been able to partner and enjoy our services.
Yep.
Of course, our service is to maintain health, and they always say, health is wealth.
Kabisa.
And equally, of course, when you have wealth, you can maintain your health.
Yep.
And I think we are going to talk about COVID and how COVID now is interfering with that attraction between health and wealth.
Kabisa. And I think that really forms the core of our conversation.
Yes.
But it's still, there's still something I would want to come out clear from you.
Yes.
I've seen some of my age mates who have gone into matatu business.
Yes.
And there are some who are also looking at, someone could be somewhere saving to start such a business. What did you tell them?
Of course you start.
Yeah.
The fact that it was a painful process for me, I know why.
Yeah.
Because I was not available there full time to manage that business.
Well.
Yeah, you see, I was trying to juggle between two, when you have a liver, it's very slippery. So it's like I'm juggling between my practice here, and I'm juggling between a very labor intensive and management intensive business,
yeah,
you start. In fact, I would say, if you want to learn business, those are some of the business you do. Matatu business, those are the easiest. Matatu business, hotel industry, those ones.
Yeah,
it will teach you how to run a business.
Well,
and so running a business is not about the young people. It's not about how much money you make. If I get someone today and he's told me I've run a business for 2 years and I'm making 20,000 every month, and I get someone else who has not done a business and he's telling me or he started a business 2 or 3 months and he's telling me I'm making 100,000, I would invest on this guy who has done it for 2 years, because that consistency, one day it will grow 1,000,000 times.
Well, so you've heard from Daktari himself. He's learned the ropes of switching from a medical career into matatu business, where he learned his skills of running a bigger institution like the one he has just mentioned, the Real group of hospitals. But you've also seen that one thing that is coming out from Daktari is that you have to be there for your business to grow, which means there's no way you can just start, go around, do your things and think that things will be managed the way you'd want. So I think that's a lesson that you should be
and definitely true. Yeah. And being there, it's not only being physically there.
Yep.
You have to put all your mind, all your emotions.
Yeah.
And that's why I'm not saying everyone can do business, because your emotions may not be in business. Sure. And you can succeed.
So that's a lesson.
Put all your time, physically, emotionally, and brain.
Well, so that's a big lesson that we are picking from there, and even us who are starting out, I think at the end of the day it will be a very big learning.
You're going places definitely.
Situations. Thank you. Yeah. Now to business, I think that now brings us to the Kenya Chamber of Commerce. Is this where your dream to join this Chamber of Commerce started? Because I can see you are really interested in business, from matatu industry to healthcare, and I'm sure there are other ventures that you may not have mentioned. How has your journey been to Chamber of Commerce? What led you to getting to KNCCI?
Okay, I would say that I entered KNCCI by default or by accident.
Yeah,
I remember that time the immediate former chamber president, Mr. Kiprono Kitonyi, who has been my mentor and luckily comes from this county.
Yeah,
I met him one day on the street.
Yeah,
and he told me in Kenya National Chamber of Commerce, and I saw he had a very big position. And he told me it's a good place. And I told him, what can you do? He said, we can provide network.
Yeah.
So one day in 2014, because of my entrepreneurial skills, I was importing gloves from Malaysia. Malaysia is a leading manufacturer. It's like tea for Kenya, for them. They grow rubber, and that's where you get the most affordable gloves.
Yep.
So one day when I was searching the internet, I found gloves from Thailand, that is a neighboring country, which were 3 times cheaper than where I used to buy from.
Yeah.
Of course, when they say, when the deal is too sweet, what do?
Think twice.
Think twice.
Yeah.
So one of the things that they are mentioning is that they do due diligence for you internationally. Yeah. So that time, I remember I paid 17,000. They did due diligence for me. They gave me a very concrete report. Yeah. And to be a surprise is that they told me the company, it doesn't exist. It doesn't have any physical address. All the contacts were given, no mobile phone, and that was in 2014. It doesn't, of course, they have a fake website, which is there. So, of course, I'm sure in this era of the youth and digital. And actually, I was reading in the news that digital crime has gone up. Digital conning has gone up. Yeah. So when they did due diligence for me, they saved me 3 million shillings.
That is the KNCCI.
That is at that time.
At that time.
So from that time, I actually was not a member. And if I was a member, I would have been charged 3,000 shillings. So I joined membership from then. And of course, after joining membership now, that is how, of course, there are many other benefits which I'm going to give out later. Yeah. So that is how I accidentally joined. And from then, from that day, I have never gone back.
Well, so what led you to going for the top leadership position that you are in right now?
Okay. Yeah, the structure of the chamber is that we have the county leadership, which I would say that when I joined, we had at that time, immediately I joined after 1 year because of my business, which I was doing.
Yep.
I was nominated to the board. And then in 2016, there were elections which came for the county.
Yep.
At that time, we were able to make sure that we put people who we know can represent the interests of the chamber.
Yep.
In my chapter, that was Gishu County then.
Yeah.
I was doing business. Okay, then of course came the elections in 2019.
Yep.
And our rallying call at that time was that we need someone from Mashinani. Because the chamber has been seen as if it is this business organization that is just in Nairobi and the other part of the world.
Kind of, is it?
Yes, yes. Not even elitist, that it is international and Kenya.
Yep.
Yeah, but of course I'd seen benefits myself. And we had seen benefits as a business organization. By the way, my chapter, Uasin Gishu County, has been one of the strongest. And we have a lot of things we've done for the business community. A lot of respect we receive from the county government.
Yeah.
We lobby, we consult each other with all the relevant regulatory authorities at the chapter then. And that's how we were able now to come to the national limelight.
Wow. So you mentioned about the rally call at that time was to have someone from Mashinani.
Yes.
I saw from the election you garnered about 280 something votes, and the person who was coming next to you was around 140 something. So I'm looking at you from Baringo and operating from Uasin Gishu. How did you manage to marshal the support even from the city of Nairobi, which is the business hub of the country?
Thank you very much. And I think this one should now go to the youth and how we conduct ourselves when it comes to elective positions.
Yeah.
One of the things is that people are looking for someone who can represent their interests and represent their interests looking at what they do.
Yeah.
So when we do elections as business people, of course, the first thing we look, are you a business person?
Yeah.
Have you run your business very well? Have you represented the business community well?
Yep.
So that is that was a rallying call.
Yeah.
And of course, when you put the CVs on the table, we don't say, I'm going to do. You say, see what I've done.
I see.
And definitely I would like to appreciate the confidence.
Yep.
Actually, it's a service we're giving. And this position that we're given is that we put our time there.
Yeah.
So I've taken away my business, and I want to give thanks to the employees of Real Hospital.
Yeah.
And to my co-directors that they've been able to run the business while I do represent the interests of the business community nationally. Yeah. So definitely I would like to appreciate Baringo County really supported me. Yeah. And of course the whole of where we are now, North Rift, and the whole country. Yeah. Generally. And it's because that we are people who are doing business, and it is not anything as we are blind to any sectionalism. Yeah. So we elect, so long as you are a business person, that is our tribe. We talk business.
Well, that sounds like the business community in Kenya is quite informed, and they are quite aware of the kind of people they would want them to represent. Yes. And I think that's a good thing. And I would say we are also a proud member of the KNCCI. And so far, I think...
congratulations, I forgot.
Asante.
And I would like to say, as Baringo County, welcome. Asante. And thank you for being members. And continue to be the members.
Thank you. Yes. Now, to Baringo County, I'm looking at the national level. Maybe before even we go to the structure of the leadership, you said you're the first vice president, which means there was a title. Was it the vice chairman? And why was there a change of name from the chairmanship to presidency? Okay. Yeah.
I would like to give a history a little bit about the chamber.
Yeah, please.
The chamber was started somewhere in 1499. That should be approximately 500 years ago. In France, in a city called Marseille in France. And then it was started because what happened is that there used to be the sea between the two countries, France and the UK. Yeah. And what happens when you send goods from one side, when they reach the other side, the other person would say you didn't send enough. So they said let's form an organization which will verify. So at that time government was not. So that is how it was. And then sometimes you send money and someone doesn't send goods.
Yep.
So there has been that. So it's a movement that started 500 years ago.
I see.
Internationally, it is one of the strongest. Actually, it is the strongest business organization.
Yeah.
And when it came to Kenya, is that the reason why it was changed to chairman to president is that internationally, we are a global movement and we are uniform. So all chairpersons are called chamber presidents. And then we have a very lean structure. We have 2 national officials usually.
Yeah.
That is a president and the assistant, and 1 nominated. Because of Kenya, we have to be. Yes. So what we need to do is that that is how the name changed, and that is the first person to have been called is Kiprono Kitony, was the chamber president, and we are very happy with him because he was able to profile the chamber.
Yep.
He was able to actually reform the chamber, because before then, you could not hear the chamber. You could not hear, you didn't even know that it existed.
True.
Because it had been there from 1965.
Yeah.
Along somewhere in the early 90s up to, there are things that happened in the chamber, which were more political than business-like. So business people ran away. So actually, I would say this is a rebranded chamber in the year of 2014. And we're happy that it was attended by His Excellency Uhuru Kenyatta. He actually came personally. And he said he wanted to see a very strong business organization in Kenya that represent the interest of big and small companies. We know we have other business organizations. Maybe associations of the media owners association, journalism, it is there, manufacturers, but then the government say that we need a body that is able to cut across all sectors. It is able to cut across in terms of turnovers, the small businesses, the big businesses. And we are proud to say that after that reform at the county, we have been able to do that. And currently, with the leadership of the current, when you came in 2019, chamber president, I think you've seen the activities that we've been able to do nationally.
A lot is happening actually.
And with his leadership, he's really done a great work for the business community in Kenya, and we really appreciate his leadership. And we want to build a mass movement
that makes sense
to grow the economy of this country.
That really makes a lot of sense because between 2014 moving forward, you could see whenever the president has a trip internationally, you would see faces of like Kiprono Kitony, which means they were accompanying the president to such trips, which would even make business sense to the community in Kenya.
Now, on a small note on that, you know, when the president leaves this country and they go outside, they'll go and see the president on the other side. The business community will come from the other side. They will greet the president. After greeting, what next? We have to connect. So, and I'm happy to report that during TICAD 8 in Japan, our chamber president, Richard Rigathi, was there with the president. I want to say that when we had the first ever African-Russia Business Summit in Sochi in November 2019, I was there with His Excellency Uhuru Kenyatta, with my chamber president, and with the business community, we are the leaders of the business community of Kenya. And we have been able to exchange information. Some even have been able to export flowers to Russia. They've been able to export horticulture. So we have a business intelligence in terms of that. So what I would say is that when you see government leaving or moving, they will sign MOUs, but who will implement MOUs?
It is us, the people in business.
It is the people in business. So I would say that is a very important thing that we have to do as a country to grow our economy.
Well, that comes out quite clearly, and maybe it now becomes a challenge to any business person in the country. You've seen it comes with an opportunity for you to network. It also comes with an opportunity for you to get to verify the validity, the authenticity of the people whom you think you would partner with elsewhere. He swung from matatu industry into healthcare business. And within the healthcare business, he went into importing gloves. And he got to save himself a loss of about 3 million, and thanks to the Chamber of Commerce. So that's one thing that you need to note. And should you be trying to venture into any kind of business, that could be the destination so that you can build a network and protect yourself as a business person. Now, back to the structure of leadership. I see Baringo, we have a chairman, and I hear there are a number of directors. Could you maybe shed some light on that? And also, we look at the numbers. From my research, I'm seeing you have about 17,000 members with over 200,000 employees, and you are present in all the counties. How is the leadership like, and what positions are elective, which ones are not elective? Maybe you can touch on that.
Okay, thank you very much.
Yeah.
Let me give a brief history of the chamber itself.
Yeah.
When we got independence in 1963 and we became a republic in 1964,
yeah,
the founding father then, Hayati Mzee Jomo Kenyatta, in his heart, business was at core.
Yeah.
So at that time, there was European chamber in Kenya, and there was Asian chamber, and there was African chamber.
Yeah.
So he said, let us collapse all these chambers and form Kenya National Chamber. And actually he said, I want the chamber to be the closest.
Yeah.
And he donated a house, a government house, to the chamber. It's called Ufanisi House, next to Parliament.
I see.
And he said when he leaves Parliament, he wants to come to where the business is, because those are the people who pay taxes to government. So then we have had a structure, and we have a very lean structure. We mean business.
Yeah.
Nationally, we have 2 leaders, the chamber president, 3 leaders, the chamber president, vice president, and a nominated second vice president.
Yep.
Regionally, we have 10 economic blocks, Jumuiya Pwani coming to Lower Eastern, Upper Eastern, Nairobi region, up to North Rift, South Rift, Western, all those areas, the economic blocks that you know. So we, business people elect regional directors.
Yeah.
And I'm happy to report that luckily in North Rift, we have 8 counties. And someone from Baringo County was elected to be the regional director for North Rift from Baringo. He's called Stanley Bascoin, the owner of Remo Bookshop.
And he's popularly known as Remo.
He's popularly known as Remo.
Yeah.
And he's one of the people who was there in the chamber before me, and he has really mentored me. And I really want to appreciate his effort. He has been a chairman for Baringo County for 2 terms.
I see.
So that is the structure. Then we come to the county. We have the chair and the vice chair and 9 other directors. So we call them boards. So there's a national board composed of 10 elected directors plus the chamber president, the vice president, and 6 other nominated directors. They form the national board. We come to the county. We have the chair, vice chair. 9 elected directors, they form 11, and 6 other nominated. And from Baringo County, we have representatives from each sub-county. So 2 except Yati, we have 1, so they form 11. So they are, all of them, when they are doing elections, they're able to say, this city is reserved for this sub-county. So that is our structure as a Kenya National Chamber of Commerce and Industries. And I think in Baringo County, we have the chair, who is Elisha.
Elisha Kiplagat.
Elisha Kiplagat, who has been very active in the ground. Yes.
I've seen him in quite a number of occasions, and I think that's something we are about to talk about. But before we go into that, should you have a question, should you have a concern, or something that you would want to be clarified by the Vice President to the KNCCI, he's here to handle those questions, and we will help to go through those questions, sample them. We will appreciate if you drop a comment there. You can also share this conversation, because other people could be missing out on this information. So like the post, share, and also give us a comment, ask a question, and we will give you an opportunity to be answered. And back to Baringo now. We've seen a number of activities happening since the elections were done in June last year. We've seen MOUs signed with some companies from Europe, macadamia planting, and farmers being given capacity to understand how to grow this cash crop. Maybe you can give us more about this activity that has been happening in Baringo. Of course, we are not selfish, because you're a national person. You can just give a highlight and also delve into some of the benefits that have come with the Chamber of Commerce during your tenure. I think it is a year now since you took up office.
Okay. Yeah. Okay. Thank you very much. And in Baringo County, in liaison with the board for Baringo and the chair being led by Elisha Kiplagat, we are very happy that they have been very vibrant. And one of the things is that is immediately they came to office, they made sure that they made contacts with the business community. They made sure the government made contacts with government, and they were able to establish MOUs with the county government. Some of the most notable outcomes for this leadership of Baringo County is that recently, I think around 4 months ago, we did launch a macadamia project, and it was being led by the chamber. We negotiated with a company called 10 Senses. It's a company that has been in existence for 10 years.
Yeah.
Macadamia is a very nice, good crop. It's a hardwood and produces nuts.
Yep.
And these nuts is the most expensive in the world. I know in Baringo County, from those areas of lowland, we do groundnuts.
Yep.
So these ones are nuts that grow on the trees. It's a macadamia nut. So we did have a project with the European Union, being led by Slovak Aid. So we were able to see the ambassador for Slovakia. And we really appreciate the network of the former chamber president, Mr. Kiprono Kitoin, who was our link. And our project was to do 53,000 seedlings.
Yeah.
At that time, the Slovak Aid was giving 50 shillings per seedling.
Yeah.
The county government was giving 50 shillings and also giving extension officers. And then the company called 10 Senses we were able to sign an MOU as a chamber, representing the farmers and the business community of off-take plan. Yeah. So in this project, we were able to plant up to now 20,000 seedlings.
20,000 seedlings.
20,000 seedlings,
yeah,
which was supplied by 10 Senses. And we are saying we want to diversify farming. So this is one of the crop, and I was surprised that in Sirwa, they've had it for almost 20 years. And remember, this crop is one of the most highly valued. Somewhere in Meru, you had 2-3 years ago that even people were putting electric fences to protect their macadamia nuts. It was fetching as high as 200 shillings
per kilo,
per kg.
Wow.
And a well taken care of tree, on average, would produce 50. Some, if of course agronomical practices, would go up to 70, 80, 90. The highest it has ever been recorded in Kenya is 120. But for normal trees, they produce up to 50 when it is fully mature from the age of between 15 and 20 years. So but of course, from 4th year, you are able to break even. Yeah. And this tree occupies very small space. You are able to do other things as you wait for the tree to grow. Yeah. And an estimation is that if you are doing 100 trees per acre, and it's going to produce, let's say on the 10th year, 20 kgs, and 20 kgs at a price of 150 shillings. You can calculate that per acre, how much you're going to earn. Sure. So if you compare yourself to maybe doing maize, doing dairy or other things, it's an alternative crop. And the fortunate about it is that it's not a perishable product. Yeah. So that is one of the things that we want to diversify. We are not saying that you change and go to macadamia 100%. As we are talking about a tree cover, because it's also a tree, so 10%. Allocate 10% of your farming to macadamia trees, and still you lose the ground for other things. True. So we are telling the people, and we have assured off-take plan. And in fact, that company had said, and we were going to partner with that company, that in an event whereby we are able to give 2 containers per month. They can be able to set up a factory. 2 containers of processed macadamia. The other projects we have been able to do as a county, we're able to bring German partners in terms of vocational education and training. Yeah. And that one, we went to Germany, all the directors from the county. And we really appreciate Honorable Joshua Kandia, who was our link person. Yeah. Went to Germany, we met the business people there. We're able to bring them back. So that's one of the other projects. MasterCard Foundation, we are partnering. And I would like to urge the business people, especially the youth and the women in Baringo. We have been given funds to give out soft loans without interest. So you have to have been in business for 1 year. You have to show us that you are youth or between 18 and 35 years. Yeah. You have to show that you're a woman between 18 and 70 years. Yep. You are in business, you have a statement for one year. And we shall be able to give you soft loans interest-free, especially in the sectors of areas which have been affected by COVID. Yeah. Restaurants, these ones who run very small shops, hawkers, the artisans, the Juakali sector. So if you are in that sector, and also the cloth making and tailoring. Yeah. Please, I'll be able to give you the contacts for the county chapter. Of course, we've also partnered with the Equity Foundation. Yeah. So far, we have been able to train 400 business people in Baringo virtually. And our target is in Baringo is to do 10,000. Wow. Business people to train them on financial literacy. It's a free program, and it's an online virtual program. We've been able to train, and we are training for free. Yep. The other thing we are having is that we've been able to partner with, especially with what is happening now in the county. There is a disaster from Lake Baringo. Yep, the flooding. Our chairman has been able to partner with the Senate office. Yeah. the county government. And in the last 2 weeks, he's visited, he's mobilizing funds from GDC, from Devolution, Ministry of Devolution, Kenya. You saw Ministry of Devolution actually. Our national office came, plus the county, Kenya, Red Cross, Kenya Civil Aviation. And these are things that are in works so that you can see how we can help our people who have been affected by floods in Baringo County. So if you want to come to the chamber, the Baringo County Chamber, we have an office at the deceased place in Kabarnet. Just at the entrance, you will see Kenya National Chamber of Commerce. I would also like to give you a mobile line if you want to call. Maybe later.
Maybe later. Before we go into that, you talked about the training, the literacy, financial literacy training that we've had. And to be sincere, they have been very helpful because...
I hope you have participated.
Yeah, that's why I'm telling you they have been very helpful because the trainings really cut across a lot in... more into how you manage your finances, how you account for every shilling that you're spending and that is coming into your company. So to you who is out there, you might need to subscribe to such courses because if you're in business, you've heard from the people who have gone before us that if you're not there to understand how your business is doing, you may not be in a position to diagnose and to get to know whether your business is doing well or not. And with such trainings, you will be able to understand your business and know. Even when you're handing over to someone else, you would be in a position to tell when things are going south or when things are doing well. Now, to the economy and COVID, and even before we go into that, maybe you can look into the disease itself. You are someone who is into the medical field. You're also specializing in infectious diseases. What really is about COVID and why is it scaring the world at this time, before even we go into what it means in the business environment?
Okay, thank you very much. And for this topic of COVID, we know right now we are in a pandemic, and everyone is scared, everyone is worried, the scientists are worried, the leadership is worried, the business community, we are worried because this disease has come, we don't have a treatment yet. We don't have perfect control measures. And we are talking about internationally. We are close to 18 million cases. We are fortunate in Africa that it has not affected us very much. But in Kenya, we are plus 30,000 with, unfortunately and sadly, we've lost over 500 lives. In Baringo County, I think the statistics we saw coming out today, I think we are at 31 cases. I'm not sure about any fatalities that have come. Definitely it is a worrying thing. Before even I go into the scientific part, so that we can link the science into health and into business, is that I would like to urge everyone in this country, and especially in this county, that we have to observe the hygiene measures. Wear a mask, that is one. We have seen, and I'll be able maybe to give you statistics later, how the mask has been able to even to control other diseases. Wash your hand, observe the social distancing. Observe the social distancing. And there's a correct way of wearing masks. I've seen, especially if you're in a crowded public place, make sure it covers your nose. I know most of you don't, it's uncomfortable, but it's something that you get used to. Remember the first time, for those ones of us, maybe youth, you don't know, when we started wearing shoes because we went to school without, the first time I wore shoes was when I was in class 4. I was not able to walk.
So I was not used to it.
I was not used to wearing shoes. So masks, I know many people are not used to it. It is only doctors who are in hospitals, who are in theater that are wearing masks. So you'll find that people wear and they just put it here. I'm not wearing a mask now because we are social distance with you. But I would like to urge that actually where it comes from, the highest quantity of the virus is from the nose. So make sure it is covered and up to the chin here. Because if you wear it and it is covering the mouth only, then there is nothing that you're doing on the mask. And it has been proved that 50% of the cases can be prevented, infections, by the mask.
Before we go into the numbers and maybe other facts about the disease, maybe we can take a short break. Then we shall be coming back to delve more into the disease because we have a specialist here who is also into business. So we have a mix of so many things in one person, and that is what we are celebrating today as a people of Baringo. And as we go into the break, let your questions come, so that when we come back, we should be able to go through them, and we also get to continue with the number of questions that we've lined up for Daktari. See you after the break.
Thank you.
Chebloch Gorge has been in existence since time immemorial. Steel bars installed by colonialists across the rocky gorge presents it as a historical site. At the boundaries of two counties, Baringo County and Elgeyo Marakwet County, it is about 200 meters long and 20 meters deep. This is where one of the longest rivers in Kenya and in the Rift Valley passes through to Lake Turkana, a journey of 4 counties, ensuring food security and water for animals and humans along the way. The Kericho River. Chebloch Gorge has created job opportunities for young dare divers who cheat death in the rocky and crocodile-infested river to entertain tourists and also have fun. Their expertise in diving is also being poached. Chebloch Gorge is only 75 kilometers from the Lake Bogoria Spa and Resort, 15 kilometers from the Rift Valley Hills Resort, and 74 kilometers from Eldoret town. Zuru Baringo, the county of 1,000 scenic views.
What we would like to urge government is that they should reduce the level of taxation, especially to the SMEs. What is happening is that the cost of production of goods in this country is gone very high. We have seen factories closing. We have seen people losing jobs. Last year alone, 2019, some of the statistics which came out is that we lost 20,000 jobs in Kenya. And the reason why that is happening is that there is a lot of over-regulation, there is a lot of over-taxation, and there is little protection of the local industry. So what we would like to urge government is that as they look forward to raise more taxes, indirectly this one is going to affect us. And as we know currently, government has come up with another taxation in terms of what we call turnover tax. What we would like to tell government is that the SMEs in the year of 2018 provided 90% of the new jobs that were created. So they should look for other innovative ways of raising taxes instead of going directly into turnover tax. In addition to that, we already, and as a private sector, we have even agreed to pay presumptive tax. And after that, if there is anything over and above, the business community is willing to pay taxes. We used to know that a few years ago, kulipa ushuru ni kufanya nini? Kujitegemea. Lakini sahizi kwa wanabiashara tunaona kwamba kulipa ushuru ni lazima hata kama hakuna. So tunataka kuambia serikali, we are ready to support. We want to widen the base and we want to increase that pot where the government is supposed to get taxes. And only that environment can happen if the policies, over-regulation is reduced, over-taxation is reduced, loans in terms of access, especially to the industries which are existing. Another thing that we would like to advise government is that we know there are some special economic zones they are developing. We want to urge them that they should give tax breaks to businesses which are already there because they know what they are supposed to do. But we have seen government is saying, yes, we want to give tax breaks, exemption of duty, waiver of duty for new businesses which are coming. But if we are not going to nurture the ones which are existing, they are going to disappear. And we are going to remain as a country that is only importing even the simplest things that we are supposed to make. But
welcome back to our show. We are continuing with a conversation with Dr. Ruto, who is the director and the proprietor for the Reale group of hospitals, and he's also the vice president for the Kenya National Chamber of Commerce and Industry, KNCCI. So we left for a break when we were looking at facts and myths about COVID-19, and why we're going into that is because we would want to bring a link between business and COVID-19, and him being a medical doctor who specialized in such kind of infectious diseases, then we are privileged to get the both sides of the coin. So Daktari, you were telling us about how to prevent COVID-19, and the best remedy is to wear your mask, because the mask has contributed highly in preventing the spread of the virus. Now, what about, I've read somewhere that this coronavirus is something that has been there, but now they are describing this as a novel, which means, is it unique virus?
Okay.
And maybe you can go into details about that.
Okay. I'll be able to give you the reason why we call it novel.
Yeah.
But before I go into that, is that one question that I want to answer is this.
Yeah.
Was the scientific community ready for this outbreak, or for any outbreak of disease? Was World Health Organization ready? Was the international community ready for an outbreak? I would say yes. But let me give a brief outbreaks that have happened before. I know with this COVID outbreak, everyone knows about the Spanish flu.
Yep.
And I would like to say that this is one of the scary things that we have had in the medical industry. It happened in 1918. At that time, I think most of us and even our grandparents might not have been born.
Yep.
And we most likely were doing hunting and gathering at that time. It affected 500 million people with a mortality of 10%. So 50 million people died. So you can see the magnitude that what happens.
Yep.
Because of science, definitely we've been able to control. I would like to say that from 1980s, we have had outbreaks of disease. You know, HIV came, the first cases in 1981. It's a virus.
Yeah.
We have had, of course, TB, tuberculosis changing. When it came to the millennium now, in 2003, now the relatives or the cousins of corona, we started seeing the first one.
Yeah.
And it was called SARS. Between 2002 and 2004, it caused a mortality of around 10,000 people. So in terms of magnitude, it was not very severe as this one, because it was not able to survive in humans, and transmissibility for that virus was very low.
Yeah.
A glimmer of hope is that by the time the outbreak was ending in 2004, in 2005 actually they found a working vaccine.
Yeah.
So what I would like to say is that these are viruses of the same family, and it's a family called coronaviruses. We have very many types of viruses. We have DNA viruses, RNA viruses, and we have a group of around 16 families.
Yeah.
So these coronaviruses, they belong to one family. In 2014, 2016, we had the outbreak of Middle East respiratory virus, which is another strain or another species of coronavirus.
Yeah.
Now we have this one.
Yeah.
The world has been ready. Actually, WHO established a unit of emerging diseases in 1983 after HIV outbreak.
Yeah.
And we've been ready. I know most of you have been watching Bill Gates. It's only Bill Gates is the one who has been in the limelight of the media.
Yeah.
But in the scientific world and as infectious disease specialist, the world has been readying itself.
I see.
For this virus, it is in this family. One, what I would like to report to the viewers is that we don't have any cure for any viral disease currently.
Yeah.
What we have is either we are able to prevent by vaccination, and most diseases that we vaccinate are viruses.
Yeah.
Even influenza virus, which is similar to this one, we're able to vaccinate. We only have medications that can reduce the load of the virus in the body, like HIV.
Yeah.
We are not able to cure it. Unfortunately for coronavirus, when it goes to the body, it causes severe disease very fast.
Yeah.
That even the medicines that would work is that they need time. So by the time the disease, you could get someone getting symptoms on day 1, on day 2 they are very sick, on day 3 they are on oxygen, on day 4 they are in ICU, and on day 5 they're very severe, or it can even lead to death.
Yeah.
So what I would like to say is that currently there is no treatment, there is no cure for a viral disease. It has been very difficult. Why? Because it goes inside the body and it goes to inside the cell.
Yeah.
And for you to be able to kill a germ, it has to be outside the cell. But this one goes to inside, and even inside, it integrates into the gene. So for you to be able to, we have medications which can kill the virus outside. But when it is inside the body, it means you have to kill the cell. And you know, the cell is what forms the body.
So that's as good as killing the person.
We have to kill you. So what we will say is that there's a glimmer of hope. And I know everyone is asking, when is normal life going to come back?
And that's what I would have asked also.
Yes.
There have been reports that some countries like Russia have discovered a vaccine.
Yes.
Where are we headed? Is there hope?
Okay. Yes, definitely what we say is that there's a glimmer of hope. I'll come a little bit to the Russian vaccine. I know everyone is asking about it. And I'm fortunate that when I traveled to Russia, I was able to meet the Minister for Health for Russia at the time, and also a very important contact from Moscow University. And we've been able to exchange information with the Russian scientists. What I would like to say is that currently World Health Organization is tracking 19 vaccines. 6 of them are what we call stage 3 or phase 3 trials. And these phase 3 trials are, it has been shown it is working. It has been shown that it does not have very major side effects. So this one we want to see various types of the population. Of course, we are eliminating the high risk people. So the third phase started in July. We are going to get results in October. So phase 1 and phase 2 are shown. 1, it is safe to be used. And 2, it is protective. So those are 6 vaccines which have reached phase 3. So a glimmer of hope is there. But let me just give a rider there. That for a vaccine to be able to establish that it is working, we have to track its effect over a period of 1 year. So now, if we're able to track the phase 3 people, we started in July, it means we are able to know that 100% it is working for 1 year by July next year. So it's not going to be something very fast. But what is happening is that by October this year, if it is working, in fact, they are like the one for Oxford University, which is the most actually, they are the ones who developed the vaccine for SARS. In 2005, and it was found to be working, but the disease had been controlled. So there's a lot of hope, and I want to tell people, just be patient a little bit, do as much little as you can. Let's make sure we control. Already, there are factories which have produced 100 million of that vaccine already. If it's going to work, it's going to be released, and I'm sure it is the frontline fast workers, the healthcare workers who are going to receive. So in Africa, definitely we are looking at, if it's going to work somewhere in January next year, vaccines will start coming, and life will go back to normal.
Well, you've talked about the phases that the vaccine testing undergo. And you said there's a third phase that is ongoing right now. Have they done it in Africa? Have those tests been done in Africa?
I know there was a controversy when 2 French scientists say that we can test this. I think one of the things is that what is that we want to appreciate. I think there was an issue about infectious diseases having more burden in Africa. And the scientists at that time thought that when now COVID comes to Africa, it's going to be devastating, it's going to be prevalent. But surprisingly, and I will give the reason why it has not affected Africa, the vaccine is being tested in UK, it's being tested in France, it's being tested in Brazil. You know, right now it has affected Brazil. It's being tested in the US, approximately 40,000 people. And there's no harm, because in testing, it has been proved even in the lab animals. So it is not that these people are looking at us that we are inferior for them to test the virus here. But I think they are going as per past history, because you only test the vaccine where the disease is prevalent, so that you know whether this person, because after that, you are going to expose this person to the community. And then you monitor whether that person gets the disease. So that is how we test whether the vaccine is efficient. Like for HIV, if unfortunately we don't have, but we are to have it, we'll definitely test in areas whereby it is prevalent. On the issue of that is that, and unfortunately, remove South Africa, we do not have any development of vaccine in Africa. So the question actually that those scientists raised, or the controversy, it's a challenge to us. We should be able to invest in science in Africa. Even in Kenya alone, we are still very far in terms of science. We are not even able to develop a testing kit, which is genetic right now, because we have not invested in our scientists. We know when we share the money, it goes to the normal suspects. I think next time the policymakers and us as a business community, we shall lobby so that part of it can go to science. We should research on how to produce the best cow. I'm going to talk a little bit about milk production. And why farmers are crying about the price of milk. It is not on the price, it's something else. So the challenge is we should be able to invest on science so that when now the Western world or developed world is doing research, why are we just sitting here and thinking that they do it for us? Why can't we do it for us so that these myths of saying they want to come and test or us something that is not working?
So we have
some people have said,
it's
family planning, it's this, tetanus vaccine and the Catholics. Why can't we do it ourselves?
I see.
The only thing is we have to invest on it. By the way, the expertise in terms of if we are to even invest in Kenya, they can train very fast. We have the basics. We have the scientists. I've trained myself.
True.
Myself, I've gone through that training of infectious disease. We have basic scientists who have trained.
Well,
and we can be able to get, but the only thing is we have to invest resources. We have to get the right machines. We have to get the right reagents. We have to get all those things.
Sure.
A science lab that is purely equipped.
Yep.
Yes.
I think that's a challenge to us as a country, and that could be a whole topic altogether that we may need to invite you one of the days to discuss innovation and
I'll appreciate
ways of creating solutions to some of our problems. Now, on COVID, it's been devastating on both health and business. How is the situation like in Kenya right now, and what is your organization, the Chamber of Commerce, doing to cushion these SMEs who are highly affected?
Okay. We know when the first case for COVID was declared on 13 March of this year by His Excellency, the President Uhuru Kenyatta. As a business community and as Kenya National Chamber of Commerce, within 2 weeks, of course, our businesses were devastated. We did a survey which informed part of the stimulus program that was done by government. And we found out that 60% of the businesses were severely affected. 30% were moderately affected. And 10% were not vis-a-vis very much affected. So definitely most of the business were affected. People are not moving. Logistics was a very difficult thing. Of course, the people in the restaurant industry, in the performance industry. And I would like to laud the government. When the government said they are giving 100 million to artists, these people were performing in crowded areas, and that was a source of livelihood. So even those are our members, and we are advocating for them. So when we did research, we were able to advise government that our SMEs, especially our SMEs, were really affected in terms of the opportunities that they had. Hotels were closed. In the matatu industry, the number of people traveling was reduced. So there was almost each and every sector was affected. Even health was definitely affected, because we had to put a lot of resources. Wearing masks for hospital workers, putting in extra measures, creating extra spaces. So it has been very expensive for the business community.
So you've mentioned about the businesses that have been affected, up to about 70% of the entire industry. And there's something you've mentioned about cushioning the government. You've been negotiating as an organization for the government to provide funds to cushion these businesses. Have these businesses started receiving these funds to cushion them?
Unfortunately, and I think this is something that definitely government should really work hard on it. We know His Excellency Uhuru Kenyatta released an economic stimulus of 56 billion. If you are to look at our economy for Kenya, we are 9 trillion. That is the GDP. What percentage of it in terms of 56 billion and 9 trillion Kenya shillings?
Quite a small percentage.
So it's quite a small percentage. Even if it is small, we appreciate. We know what the government can do. And as business people, we are not saying Serikali's idea. But where they can help, let the help come as fast as possible. So what we are saying is that those funds have not been have not reached the SMEs. I know, of course, the other things like, is it Kazi Mtaani?
Yeah.
I think it has come, and we really appreciate.
Yep.
Because those are youth. If our youth are idle, then the economy goes down. So definitely we appreciate. But the one for the tourism, I think it has not reached.
Yeah.
And the one for, I think this one for tourism, KWS, the Rangers, there was something on that. It has not come. And these other sectors, infrastructure, we've started seeing something in Nairobi Metropolitan. I don't know whether it is part of that.
Yeah.
But our business, especially the ones which were supposed to be the business guarantee loan of 3 billion, it was part of the stimulus.
Yeah.
It has not. It has not come.
Yeah.
So that government can provide a guarantee, so that we can be able to get non-secured loans, especially the small SMEs which are affected. So what I would like to urge government, and also regulatory and legislature, so part of it is procedural.
Yeah.
Like the one for tourism I was asking, it was supposed to be passed in August. I think as it's called Public Finance, under the Public Finance Act. So part of it is also, and I think even our members of parliament should go extra mile to see that those things that have been put as economic stimulus, especially for COVID, should be done as an emergency, as how health workers have volunteered to wake up at night to go to work and even put more extra hours. Yeah. We want to see each and every one, those ones who are in charge of our economy, to be able even to work extra hours, and even if it is at night or over the weekend, we want them to do that. And as business community, we want to lobby for that. We want to advocate for that, and that is the information that when we had an opportunity for, we are in the emergency team, national, those are some of the things we do as a chamber. Our chamber president is our representative, and this is what he has been pushing to make sure that the economic stimulus comes to the businesses.
Well, that is coming out clearly, but maybe before I ask you another question, I would want to inform you, the viewer, that it's quite a rich conversation. We estimated that we would do it within 1 hour, and you can see we are past the first hour. It's about 9 minutes past 9 p.m. And I would say we are like 3/4 way of our conversation. And before we move on to the next question, you might have started seeing on the screen, there's an opportunity that the Vice President for the KNCCI has come with tonight. And if you're viewing and you're an agronomist who is specialized in fruit farming, then there is an opportunity for you. There's a factory that is being set up in Kericho Valley, and it needs you as an agronomist who is specialized in fruit farming. Check the crawler, the email of the person whom you'll need to send your email, or rather to send your CV to, is running on your screen. So take advantage of the opportunity, and lucky is you who's been watching and you have such kind of qualifications. And further to that as well, knowing that Daktari is part of the proprietors, or rather among the proprietors of the Reale group of hospitals. Get more details about the hospital running on your screen on the crawler. Now, back to you, Daktari. You've, on the stimulus package that the government brought, we've been undergoing trainings as the business people in Baringo. How soon are we getting this money? You've mentioned that there are a number of procedures, but in your estimation, from the leadership point of view, give us some hope, man.
I cannot be able to give you what government is doing, but as the Kenya National Chamber of Commerce, we already have negotiated with our partners, MasterCard Foundation, I think I mentioned earlier, and you can be able to reach the county chapter, and I'll give you the contact so that we have some funds for 3 sectors, that is the Juakali sector, hawkers, those people have small businesses, small shops, people in the restaurant industry, people in the fashion and tailoring industry. I want to give you the contact for our county chamber. You first of all, one of the requirements is that you must be a chamber member, so that you can be able to contact. And can I read?
Please do.
So 0748 190 112. That is a contact for our county chapter, and the headquarters is at Kabarnet. So can I repeat the number? 0748 190 112. So one, and then the second one is that also we are is going to. I'm sure you've seen on the news the equity training we are having.
Yes.
After the training, of course, one of the requirements is that you must have undergone the training. And our target is to train 3 million SMEs in Kenya in partnership with the Equity Foundation.
Yeah.
And you can be able to get an unsecured loan. After that, it's so the pipeline. I might not be able to give you the exact date, but training is ongoing. When we get a critical number of people who've been trained, we shall be able now to give you the guidelines for application for these loans, especially for SMEs which have been affected by COVID.
Thank you. I think why I was asking that is because we are also an interested party. You can see we are still growing, and with such stimulus packages that the president is giving, then it will be beneficial to us as an organization as well. Now, you've given the contact. People already have the contact person at the county level. If I want to join as an individual at the Chamber of Commerce, what does it take for me? And if I have a company, what does it take?
Okay.
Yeah.
At the county, we have several membership. We have county membership. We have national membership. At the county membership, before COVID, it depends on the kind of services that you need and the turnover of your company. The minimum in Baringo County initially was 3,000, and we had members who were paying 10,000, 20,000, and corporates who were paying 100,000 as members. Of course, as you had said initially, when we bring the program, we are lobby and also business intelligence and business network. If you come to a WhatsApp group, if there's something you're selling, if there's an information you want, if there's something you want market intelligence, myself, I can be able to provide. Like as I sit here, there's a businessman from North Africa who was saying that I need 1.2 tons of avocado every week. Wow. That's a business intelligence information I have. These macadamia that we started, there's already market, and there's a market that they cannot satisfy for the next approximately 20 years because the tree takes a long time to grow. Sure. So what I would like to say is that you need to have run a business. You need to be a business person, whether it is by your name or a company. You can join the Kenya National Chamber of Commerce at the county level. At the national level, because we do more of international business intelligence, also high-level government networking. If there are things that you want to lobby for government to be able to, in terms of your business, you can join our national membership. We are based in Nairobi, and it starts from 100,000, 300,000, and we have patron members at 1 million Kenya shillings. Where you have the opportunity to participate at the highest level. We usually have quarterly presidential roundtables where the cabinet attends and His Excellency the President, and you as a business person at that patron level, you can be able to directly talk with government and the decision makers and tell them that we need this, we need A, B, C, D. You can lobby for issues of taxes, for issues of preferential tariffs for your business, and even for opportunities that you might want government to be able to provide in terms of putting the right regulatory and infrastructure for you.
Sure.
Thank you.
That really props the mandate of KNCCI, which is all about promoting sustainability or sustainable business growth and the economy in general. So even, which means also you also get, by being there, you get an opportunity to have a bigger bargaining power, unlike when you're acting as a lone ranger. Now, to taxation, corruption, and maybe delayed payments by government, which is the biggest, or rather one of the best, I would say best and the biggest employer among the business people. What other challenges are SMEs facing aside from the COVID that we are in? And I'm asking this in line with what you, the viewer, may have seen when we went on a break. There was a video that you were speaking in Kabarnet, I think it was in January this year, and you were urging the government to lower the taxation, and you're even saying that you would lobby for the SMEs to pay a presumptive tax, and anything beyond that, then maybe the government itajipanga or maybe look for other ways of increasing the tax by widening the tax base and all that. What other challenges are the SMEs facing aside from the three that I've mentioned?
Okay, thank you. I think let me start with the easiest for us to be able to move fast because we don't have time. The issue of delayed payments, This is something that we saw. It was very severe when we came to 2016, 2017, 2018.
Yeah.
That when people started doing business with especially with counties at that time, especially the small businesses, that government was not paid. You could be given a contract of $1 million. Maybe that is your balance sheet. That's your capital.
Yeah.
You borrow a loan, and the loan is supposed to be paid within 2 or 3 years. The county government gives you a commitment. Once you finish, you raise your certificates, you're paid.
Yeah.
Then it is delayed for 3 years.
Yeah.
What happens with that business person? You're auctioned. And we had a lot of auctions. You saw in the newspaper. Yeah. From 2017 and 2018, and we had to lobby. And I think it ended in the last year. Yeah. Where the president pronounced that government was going to prioritize payment of pending bills. Yeah. And we were happy that at least 70% of that, but the damage already had been done. Yeah. Many businesses, especially the small business, had collapsed. So what we want to say is that for government officers, we know 30% of the opportunities that are there. Go to the government is the largest business partner. Yeah. They should be able to pay the bills. Sure. And as we go forward, I think government has to, and there was a law which was being done in Parliament, that they could be able to have something like a construction bank, or a bank that can be, if you do supplies to government, you are able to be paid as government waits for its other regulatory procedures. Yeah. So on the issue of pending bills, definitely we are at the forefront of lobbying. We have been lobbying government, and I think the SMEs now is not a very big, although 30% is still a problem. Yeah. The next one that I would like to handle is the issue of taxation, and definitely you got it right. There was an introduction of 3% turnover tax. If you are looking at someone who is selling Safaricom cards, how much is the profit? So if you are to charge that person and he doesn't reach the turnover of 5 million per year, whereby you can be able to say now, I'm exempted from turnover tax. Yeah. So definitely that was one of our points as business people in Kenya. Actually, we want everyone to pay taxes. Yep. In fact, if produce one egg, we want the penetration of taxation to go to the lowest level. Because the wider the net, the lesser the tax. Sure. But the problem is already government is taxing the existing tax net. So it is not expanding. Yeah. So if you are going to fish, you fish in a very small, however deep you go. Because the issue of introduction of 3% was going deeper to get the fish. And you know, the more you go deeper, the more there is less oxygen. Sure. And the more there is no fish. Yeah. So government was going to strangle businesses. And actually, when COVID came, we argued with government, and we were happy that they were able to reduce that turnover tax from 3% to 1%. Wow. We are one of the highly taxed country in the world and also in the region. You know, we are part of the East African Economic Bloc. Sure. We are one of the highest taxed as a country. Yeah. So we have to look at not. Is it eating the egg that lays the chicken, or how do we call it? We should first get, then we can tax. Yeah. So we start by taxing, because even on presumptive tax or advance tax, government is saying whatever you declare, you have to pay it in advance. What happens if, for instance, a business goes into a loss? I've not seen any refunds from government. If you get fire, your business is banned by fire. What happens? Because today, we are not declaring profits every month or every quarterly. Yeah. We declare yearly, and that is how we do business. So those are some of the things that we are arguing with government and lobbying and advocating. Yeah. We know government needs taxes, and we are ready to do that. Yeah. But it is a structure of the economy that if we are not able to expand our economy, we are not able to do something called import substitution. We are not able to increase our exports. Yep. Our trade balance has reached a critical stage that this country cannot survive. We are at a negative 1.1 trillion in terms of imports, exports of approximately 1.7 trillion. We are exporting 600 billion. We are importing 1.1 trillion. So there's a negative. And that negative, it is not, if the gap is not bridged, it is like making ugali in your house. Yep. You are bringing the maize, you are bringing the water, you are buying the firewood, Even the house that you are cooking from is rented.
Yeah.
So that is what we are doing as Kenya. If we are not able to, if we can't, and another thing is that the basic need that is food, as the first basic need, we are net importer of food as a country. You would be surprised, and I'm talking from here, because Baringo, you produce milk. Go to the supermarkets and you'll get something called American Garden. Sorry, not American Garden, American Kitchen. This is basic processed tomatoes. And when we are part of the negotiation of the free trade agreement between ourselves and and the US, if America is going to export food to Kenya, and it's a first world, what opportunity do we have as a country?
Almost none.
And we are producing tomatoes from our irrigation scheme, which was started in 1953-54 in Marigat.
And we leave them rotting like the ones we were seeing.
So what we need to do, we need to engineer, we need to be innovative.
Sure.
And there's no other person than you as the youth.
Well.
Because the world has become a global village. You cannot survive. The market needs the product, good quality product at the right price.
Well,
we can't say we want to demand high prices while the global economy is giving in high quality and lower prices. We have to make it efficient.
Well, I think that was well explained.
And the issue of corruption,
and
that one I have to state categorically.
One,
as business people, we want to say we don't want to participate in corruption. But I want to warn especially the people who give out information and the media houses that there has been a systemic banishing of small companies and Kenyan companies. Because when you say corruption has been there, I have never seen, especially recently, there has to be someone who is receiving and giving out. Why are they not interviewing the businesses that they are accusing that they have done? Why are they not verifying information? So what I would say is that there is something called corruptionomics in Kenya, whereby if you don't get a business, or if you get, it is like when I was growing up, if you do well, if you have a shop and you start wholesale, they will say you are a devil worshipper. So the media is especially local companies. And by the way, we as Chamber, we are not taking it lightly. And it's not a crime to do business. If I supply 1 billion, it should be hallelujah. Because next time, if I supply, next time I'll be manufacturing.
Sure.
I'm giving capacity to the SMEs. So if we kill these small companies, local, because I've not seen this issue of saying corruption for the big international companies. For companies which do corruption, we abhor. We don't accept as an organization. But the fact that someone has done business does not mean it's corruption. So we should differentiate the two.
In fact, I was to come to that because somehow I felt you might forget about that because there was a mention of the highest office.
And tell me one thing. There has been a lot of talk of corruption from a lot, of course, from when this country came into being. But recently, it has really gone up. Who is accepting this corruption? So we must differentiate between corruption. We must differentiate between competition. We must also differentiate between true and false information. And yes, in corruption, we know business cannot thrive. In fact, we are the first people to go under. Because if I'm doing genuine business and you're corrupt, it means you can sell your things cheaper. It means you can get free capital. You will neither supply hewa.
Sure.
So anyone who has supplied hewa, like I've seen in the media, I don't know whether it is true. And I would wish it is not true. For us, we will say, you hang as per the crime that you did. Well, but if you have not done it, we have not. So the efforts that have been there. So where is this money? We are talking every time about corruption. How come we are not even seeing it on the street? Okay, let's leave it at that because it's becoming more of an issue that is, to you, it may have been inflated, or rather, maybe the whistleblowers may have taken things out of proportion. But moving on that, even on the recent issue, the evidence that came, what was procured is 7.9 billion. The issue was 43 billion. We don't have documentary evidence of 43. And investigative journalism, as someone who has sworn the oath of journalism, should be able to provide us. And if you, by the way, you are betting corruption if you don't give true information. Yes. And actually, even you see high-level corruption cases, it's a 100 billion lost. When you go to court, people are saying it was procedures, it is 100 million, 200 million. It's money, yes. But we must have to put systems that guards us against corruption. But the corruption we have in this country is policy corruption.
Well, they say any system is as good as the people who are implementing it. Exactly. So I think even to our leaders, it is an opportunity to change how we are doing things. And as Daktari has said, business is really going down because of corruption. And the biggest people to suffer from corruption is the people who are doing business on a daily basis. To the Public Procurement Amendment, is it Public Procurement and Asset Disposal Act? There was an amendment that was proposed in 2019. And I saw an article on one of the dailies. They were really praising the originator of this amendment, who is Mheshimiwa Moses Kuria, the MP for Gatundu. You were at the forefront pushing for this bill, which was pushing for payment of young people, women, and those people with disabilities who are already transacting with the government. They were recommending that they get to be paid at least or at most 30 days after they receive, or rather after they issue their invoices. You are pushing for it. Has it been approved yet? And what would be the future of such a bill? Or rather, what would be the future of us as the young people in business if such a bill is
Okay, thank you. I think there was one thing about, there was an amendment which was approved and assented, that it is a crime to procure goods by government. If you are the officer doing, you have the procurement director, if there are no funds. Initially, public officers could have a project, funds are not there, and they give out the contract. So that one, I think it has been able to sort part of the pending bills issues. On the issue of the Public Procurement and Disposal Act amendments that are being put, one, of course, was that we are pushing for is that to guard against the issue of pending bills. If you have completed either supply or the contract, certificates have been approved by all relevant authorities. It should be paid within 30 days. In an event where it is not paid, whatever is due attracts commercial interest. And that is something we are looking forward and lobbying for. That is one. The second one is the one for Moses Kuria is that it was looking at and it is interrelated with the third one of Rigathi Gachagua of the local content. That if government was to advertise for a project of 1 billion or 2 billion or whatever money, there could be an infrastructure bank that you have the technical capacity. Because actually the reason why our local companies are not able to do these projects is because of issues of finance. The cost of money, the cost of finance in Kenya is very expensive. And so that one is that there could be funds which are set aside, that if you get a contract, you can be able to be advanced, and then you do the contract and you complete. I know there has been a lot of international companies which have been doing our major infrastructure projects. If it is road, if it is power, if it is water. Just imagine if these were local companies which were doing them. What could be the impact of the economy? So I come to the next one, which is Rigathi Gachagua, and you're saying that any tenders which are 1 billion and below, and there is local capacity, should be preserved for local companies. In fact, as we are saying, the ceiling of 1 billion should not be there. It should be criminal that if we have the capacity as a country, it should be preserved for local investors and for local contractors. In addition to that, and it is something we are still lobbying, is that even for the ones we don't have capacity, but we have local content. And I'll give a major example of the largest infrastructure project since independence, that is the standard gauge railway. We knew cement came from China. We have very big cement factories in Kenya here. They had the capacity to produce. Steel came when it was ready. there was no value addition of steel in Kenya. And what the Kenyan companies were just given is to do beautification, kupanda nyasi. Who doesn't know how to do that? Very little money. So what we want to say is that whatever is available locally should be actually within. It should not be just by a policy that is saying preserve for local. It should be signed as a contract, and the international company should be able to look for partners. And in terms of awarding marks and awarding the contracts during the evaluation, marks should be awarded for companies which have been able now to sign local content with the local companies, so that we are able to, because even if it is loans, it is our money, because we have to pay. When you borrow your loan, does the bank follow you to tell you, we have to know where you are going to spend this money? No. How you are going to spend? You are going to buy from the bank? Theirs is just to receive the payment. If a country gives us loan, we should be the ones to determine how we spend, because it's not their money, it's our money, because we have to pay back.
Well, you've really emphasized on the local companies being empowered. And I think much of what you're speaking is the future tense. Do you think the empowerment of the local companies will happen any soon?
The future?
The future. Will the future accommodate
the future
your dream
between me and you? It doesn't lie anywhere. You are the leaders of tomorrow, and tomorrow is today, and this is yesterday.
We are the leaders of tomorrow, and tomorrow is today.
And tomorrow is yesterday.
And tomorrow is yesterday as well.
We have not been able to do it yesterday. We are trying to push it now. And if we don't do it tomorrow, it will be a song.
Well,
so what are especially the youth and the people who are coming into business? If we don't push for this, it's going to become constricted, small, and small. And all of us, we are going to perish together.
Well,
so the future in terms of local content, yes, must. So let us go for all of us. Let us go to business if your heart is there. Go for leadership. Go change if your heart is there. And I'm looking forward to getting leaders who really, the also problem is us. You know, when a leader goes, you know how we judge leaders is the social responsibility. As opposed to what they do.
At the policy level.
At the policy level. Actually, if we judge a leader if today I was to judge my local member of parliament by how many he has been able to lobby for the reduction of taxes. He's a vice chair for budget, and I remember I mentioned to this. And I'm very happy that he has actually personally come to the chamber to pay a courtesy call. He has given the chamber an appointment in parliament. So, and I think it's not by default that he's inside for the third term. So what I would say is that we need more of leaders who are able to solve issues, who are able to be able to come with policies to make that you're able to fish and not give you the fish.
Well, talking about that, and I saw a joke, there was an MP who was quoted saying that I'm silent in parliament but I'm very active implementing projects on the ground. Then somebody was telling, or rather was challenging the MP that if only he knew that CDF was a policy that was written by a colleague MP who came before him. So I like your approach. We've really taken time, and I really apologize to the viewers who have been sending out questions. I can see quite a number of comments that are congratulating you for what you're doing and appreciating your work.
Thank you.
But I've sampled about 3 questions and maybe a comment. Lois Onyango, who is the president for Rotary Elder Ravine chapter, which was launched the other day, is saying that those are great insights and quite an informative session. So maybe that comment by Lois can represent those who are appreciating what you're doing. Joshua Keitany, who is watching from the UK, is saying that thanks for the great show, Dr. Ruto. In line with your vision to influence the development policies, what would you advise someone interested in green energy sector, that is solar energy? Some government policies favor rich corporations in terms of selling energy to the national grid. I believe you got that. Joshua Keitany, who's watching from the UK, is interested to know what your advice would be to someone who has interest in solar energy. Eric Yai, you're saying you're tuned in with your notebook, and that's quite a good thing. You're telling me, the moderator, kindly greet Daktari. We'll do that. And also don't forget to tell him that Baringo County, as a people of Baringo County, we are proud of you, Daktari. I thought that would have been a question, but it has turned out to be an appreciation. Janet Kriswa, you're asking, being a doctor, how would you rate Baringo County in the level of preparedness of handling the pandemic? And I think that's a very pertinent question, because when the first cases in Baringo were announced, there was a joke going around that the Captain Boras Isolation Center would have been full on the first or maybe the second phase of the cases that were found in Baringo. Finally, Philemon Kiprop, you're saying bravo, Baringo News, for hosting Daktari. Kenya needs such brilliant minds to spearhead the economic recovery. I'm privileged to have been mentored by Dr. Ruto. That is Philemon Kiprop. And there are quite so many comments that are appreciating your work. I've just read about 4 of them, but majority of the comments are appreciating what you're doing. Now, Daktari, maybe you can take a moment to respond to those 2 questions or 3 of them.
Okay.
Then we can head to the tail end of our conversation.
Okay, thank you very much. And just remind me before I forget.
Yep.
Because I really want to link Kenya National Chamber of Commerce. I know I've been able to. What are the direct benefits? And I'll be able to come into that.
I'll come to that. Yeah.
1 or 2 examples.
Yeah.
Lois, I have followed Lois and Rotary. I think it's the first time that Rotary Club is coming to Ravine.
It's actually the first one in the county, Baringo.
Okay.
Yeah.
So Lois, thank you very much, and I really appreciate that.
Yeah.
I followed it on social media.
Yeah.
And one day I think you invite me, and we can see what we can do for the people of Baringo. I know Rotary Club is an organization that is handling issues on humanitarian issues.
Yeah.
Green energy. And this is something that I think Joshua from UK.
Yep.
You can find me on my Twitter handle.
Yep.
You can be able to communicate to me, and we shall be able to get his contact. Because one of the issues that we have is that if you put solar in your business or in your house, if you have excess energy, there's not platform for you to sell to the Kenya
national grid.
To the national grid. Yet in developed countries, and I'm sure where Joshua is coming from in UK, we can be able to, at the chamber, we have a sector for energy, and we can be able to lobby. We can even sponsor our private members' bill in Parliament. We can even go and see the policymakers. That is the Minister for Energy. We have an MOU already with government, and our chamber president is a special economic advisor. So as I know that issue of solar, especially not favoring the small people, but what I would say is that we are doing very well. Actually, North Rift hosts the largest solar farm in sub-Saharan Africa, 93 megawatts. It is done by DL, David Lagat, who is the chairman of DL Group of Companies. He is also in the tea industry. It is in Uasin County. Is doing 93 megawatts. We also, the largest solar farm is in Morocco. I think it's around 150 megawatts. So we are doing bad. It's also the son of the soil who is doing it. So that is dear Langat.
So maybe
on energy, I would really like to do a follow-up.
So maybe
so please,
to Joshua,
I think, get my contacts. We can see what we can do together. I know government has, Kenya was being projected to increase manufacturing to a contribution by GDP to 15%. Right now, I think we are 7.2, and maybe we've dropped to around 7. We are not even able to consume the power that we have in the grid. So that's one of the challenges. I think that's what is happening. Kiai, let me say hi to you. You said hi to me. Thank you very much. And thank you for appreciating the efforts of my leadership in the business community. I think it was also Philemon Kiprop. I've been a mentor to you. Thank you very much for appreciation. And I hope you can now mentor 1,000 other people. So that you can become, they can become the person that you are currently. Let me respond to the Baringo County in terms of preparedness to COVID-19 outbreak. I would say in terms of prevention, they're doing well. You even saw in Ravine, there was a suspicious case or in one of the hotels, and I think they did fumigation. That was good.
Yep.
I'd like to appreciate. I also want to register that I'm the chairman of Ravine Sub-County Hospital.
Oh.
And we have the kits. So we have the first line workers. They have the protective gear. I would not want to put Baringo in isolation. You know, there was 5 billion which was provided by the national government, so that they can give it for preparedness. As a country, I would say we are doing very well on prevention, but if we are to have the numbers that we are seeing in the West, definitely not even Baringo County, no county is able to handle. And let me come to specifically the critical cases. How many critical ICU nurses do you have in Baringo? Or even in any county in this, even in Kenyatta National Hospital. Before COVID, all the beds for ICU in Kenyatta were always 99.9 full. That a patient would wait for a patient to be discharged. And you know, being discharged from ICU can mean either way. So tell me that we have been able just to double the number of ICU beds in this country, both in private and public. We have not been able to double the staff because it takes 2 years to train an ICU nurse. The doctors who are specialized, it takes approximately 5 years to train. Anesthesiologists who are supposed to. In Baringo County, we don't even have anesthesiologists in the whole of Baringo County. We are still very far. And I would really urge to policymakers that when doctors come and they go for further studies, unlike other professions, because we are dealing with very sensitive matters, that is your health and a human being, the skill required has to be very perfect. And that is why, unlike other fields whereby, in fact, I was surprised some governors when they came and they said, why is someone going for further studies when you just become a general doctor? And they say, why are you earning a salary? When you go, you work and you train. And that is why in Kabarnet, we don't even have anesthesiologists. We're supposed to be the overall overseer of ICU. I think we have only one physician. So in terms of preparedness, and it is across the whole country. We have a shortage. We have 12,000 doctors. I think now it could be 13,000 in the whole country, both private and public. And as per WHO requirements, we are supposed to have 61,000 doctors. So you can see in terms of preparedness, it's not only Baringo, it is the whole country. We have to prepare ourselves. We have to be ready ourselves. We have to improve. And I'm sure it is everywhere. If you talk of engineers, I think we have a problem. Even teachers, if we are to have the ratios that are required by international standards, we still have a shortage.
So
yes,
you've put Baringo as not an isolated case.
Yes.
What other things can we do just to improve our situation? You've mentioned the policymakers, but now back to Baringo as a county itself. Aside from the preventive measures, what other things can we do to prevent the spread of this COVID-19?
There's no other way. You have to do the prevention measures. Well, no other way. It's science. And that science has proved even America wrong.
Well,
when America started, they say it's going to be wiped by the sun. So they defied science. With the summer has come. Has it done? Not yet. So science has said we follow those measures.
Well, back to the same question.
The only thing that I think I would like to urge is that we have to increase. If you're going to an enemy, how would you want to approach your enemy? Let's say your enemy is in north, and you can go to east, west, or south. How do you know your enemy is in the north? You have to know where the enemy is. The physical location. As a country, we are not doing testing, so we don't know where the virus is. We are only knowing the virus when it has affected you. And we say 90% are asymptomatic, documented in Kenya, as opposed to the West where it's 80%. No, 20% 80% asymptomatic. We don't know how this disease is spreading. The closest we have come is we have been able to screen blood donated, and it is approximately, I think now it's gone to 7%. Is it 7? Yes, 7%. So 47 million Kenyans, 7% is approximately 3 million. And you had the CAS for Health, Dr. Mwangangi, Mercy Mwangangi, was saying that they are estimating there are 3 million by, of course, science and by doing that extrapolation. But in the US, you saw in New York, It's a population of, New York is a population of, is it 18 million? By the second month, they had tested 10 million people.
Second month.
Yes, that was
so
16.
the capacity is something that you recommend
we
that
need,
we increase.
For us to fight this virus,
yeah,
we need to know how it is spreading. We need to know who are spreading, because who has been tested here? You maybe have you been tested?
No, not yet.
I've tested myself, and I turned out to be negative. So, but it was a large population. It was found. I had in the county. I think there was a random testing at the governor's office, and 5 people were found. Yeah. So just imagine we didn't test. You know, there are still people who believe that there is COVID is not there.
So COVID is there.
It is there.
We can just agree on that and concentrate on reducing, or rather protecting ourselves so that we can reduce the spread of the virus. Now, to your venture as a healthcare entrepreneur, you've set up one of the biggest hospitals in the North Rift, and I believe you've really contributed a lot in the healthcare systems there. How has the situation been with the COVID?
Okay, what I would say is that one of the things we've seen, what can prevention measures do? And of course, cost of offering healthcare in the private sector has gone up. Because one, we must protect our healthcare workers. Yeah. In addition to getting them what we call surgical masks, which are much more expensive than the regular masks that we are wearing. We have the face shields that we are using. In theaters, we are any suspected case, we are doing full gear, and a full gear in the private sector. Right now, it's a little bit calmed down, but initially when it started, it was even up to 10,000 shillings. One of the things is that the number of patients, initially they were scared to come to hospital because everyone thought that hospitals has COVID. Yeah. So we saw cases of diabetes, cases of epilepsy, cases of high blood pressure, cases of asthma, coming to hospital when they were very severe. Wow. So because they feared coming to hospital, they did not pick their drugs. These are chronic disease, so it might not immediately, you might not have severe symptoms. Yeah. So we saw cases coming in very severe. But we have seen that those chronic conditions, they've accepted, although it's not yet full. We used to see upper respiratory tract infections was approximately 30%. It has been reduced to less than 1%. So the numbers in terms of people who are coming to hospitals has come down, which is good. So it means prevention, by the way. In fact, I was saying, if life could continue with masks, it's unfortunate anyway we're not created to be wearing masks.
But do you think the numbers have gone down because of the preventive, the masks?
Yes.
Or is it because we fear coming to the hospital?
One contributor, and I think the major. It's a major, because I've been able to analyze the numbers and the disease epidemiology, the conditions. One of the largest contributing factor is hygiene measures. Wear a mask. It's very rare to get someone who is coughing. True. Unless it's allergy, it's cold, there's a lot of dust, there are chemicals. Rare nowadays to hear. Yeah. Of course, maybe people fear coughing.
But you can't prevent it from coming out.
Remember, in social media, there are a lot of jokes. When someone coughs, everyone disappears. Yeah, that was. I'm lucky that I have a small allergy. I'm lucky that I didn't cough. I'm sure you would have run away. So now the numbers have come down. You are washing your hands. Sure. You are eating at home because the hotels were closed. 10% of the conditions that you come to hospital was gastrointestinal because of food poisoning. Eating food that has some germs here and there. Traveling has reduced, accidents has come down. But of course, there is normality. People cannot survive without traveling. True. So what I would say is that hospitals, yes, financially have been negatively affected, but in terms of human, positively affected. I would say for me, it's better to deal with a healthy population. In fact, what we are thinking now is about what are these other more preventive issues that we want to do. Issues of weight reduction, nutritional counseling, that you should come to hospital, because that is the next outbreak of disease that we're going to have, but it is silent.
Maybe a quick one. Did you set up an isolation center in your facility?
Yes.
Has there been a case in your facility?
I would say COVID is there. Yeah. If I tell you 7%, and we have a thorough screening method, thorough. thorough. And we have got cases that they're suspicious. We've tested, and they've come out to be positive. And they were not, the only thing is just other symptoms that are very mild. Someone was not coughing, there was no fever. But general, there was other symptoms that we were able to. So one is, yes, as Real Hospital, we have got cases. And I can't think of, I'm also a member of the Kenya Association of Private Hospitals. I don't have any facility which has not tested positive. Which has not gotten a
positive case. So I was asking that question because I'm quite keen, or rather, part of what we're doing as Baringo News is to make sure that we put the word out there that this disease exists, and we cannot just sit and assume that we are safe when we are not. Well, we are heading to the tail end of this conversation, and maybe with your position and your experience in business, people say that there's an opportunity in every crisis. Do you think there's an opportunity that has come with COVID?
The first thing that when COVID came is that there was international travel banned. Even people didn't know how to move cargo. In Kenya, we started even getting shortages of basic things. Even the price of onions went up because Tanzania and Kenya, traveling was banned. So the opportunity there is that there are things we can do, as simple as doing onions. In Baringo County, I think we are one of the largest producers of onions. But we are not able to produce these onions in large capacity. And in economies of scale that we're able to compete with onions which are imported. In terms of other things which are imported, finished goods from other countries, I think this is an opportunity for especially the young people that let us remove the gloves, let's go, let us wear the boots, and let us go and make something. Like today, when I'm talking here, there's a gadget you've put on I don't know what you call it in journalism. I would be very happy when I come here next time that I'm wearing something that
is made locally.
Is even assembled, this one locally. Then we can start the other process. And what I would like to ask the people is, your kazi ya mkono. Using this professional work. Even as a doctor, it's a physical work. People think that it's elitist. You have to come to hospital. I have to examine you. I have to see you. I have to go to theater. So this guy, ourselves, let's go to the farm. Let us make a small tractor. Let us innovate. Let us modernize our farming. Let us become carpenters. Even the seats that we are sitting on, it's not good that we are sitting on a seat that's imported. These are basics, very basic.
So Daktari here is challenging us to venture into innovation and also roll our sleeves and start working, because COVID has presented an opportunity for local manufacturers to start producing things that can be done here in Kenya. And finally, to you, Daktari, with your position, of course, and your experience in business, what advice can you give to the SMEs at this time of COVID-19?
Okay, what I would say is, even before I go there, I have one request that has been coming to the chamber of meat by the Egyptian government to supply meat to their military and to supply meat to the 80 million people. Egypt is seeing Kenya as a strategy and Ethiopia because they're using Nile water. If we are happy, they are happy. If we are not happy, they're importing meat from Brazil. The ambassador has come to the chamber. I have gone to their embassy office. They have come recently. They came almost 9 months ago. Baringo, I know we are one of the largest keepers of livestock. And the only problem we have is that we have not built capacity. When you see this Maoi slaughterhouse, abattoir being done, it is not something small. It is something that can change the economy of Baringo County 10 times. Because imagine if we are able to supply meat to only one country, 80 million. It means even land will not be enough in Baringo
to rear these animals.
And we shall be millionaires. Everyone. It's not normal to have millionaires in a society, everyone.
Yeah.
So that is one opportunity. I mentioned about the avocado. There are other things that they've said they have been able to negotiate. Last year we attended the largest fresh food market in France. It is a logistics center. They are telling us, what is your products, what is your price? But if you come to Baringo, for instance, and I want to sell powder milk, who is processing powder milk in Baringo County? Is there anyone?
None.
Who is processing milk? And I would like to quote, people try to blame the big companies. Brookside is in Kiambu. Go to Kiambu, they have 52 processing companies for milk. Baringo, how many do we have? Let us not wait for government to come and do BAMCOs here. Why can't we get people to do it? Kiambu has 52. 52. Baringo, how many do we have? And the shortage of milk in the whole world. The unfortunate thing is that if we are not able to offtake milk, the farmer will not feed the cow. We are competing between a cow in Europe which produces 40 liters and a cow in Moringo which produces 5 liters. So even if you put milk by air, which British Airways, ikuja mpaka Nairobi, it will be cheaper than the milk which is produced in Moringo. And if you put it in the shop, which is a famous shop here in the Ravine, there used to be Kisii at one point. And you put it and it's the same quality of milk. Which one would you buy? Ile imepitia ndege ama ile imepitia bicycle? You'll buy the cheaper one.
Sure.
So we have to look at how we produce things cheap. It's not about saying, our milk is price is 17 shillings, is 32. Why can you sell at 17 and sell 40 liters instead of 5 liters? It's not volumes, it's about cost of production and that volume. You have a cow that produces 5 liters and it eats a lot. It is 10 kgs. But that 10 kgs, 9 kgs is the waste. Then 1 kg is the milk. You will not survive.
Sure.
Farmers will always say government is bad.
You had said something about the cow.
Yes.
What did you want to say about that?
It's an issue, and I want the youth, and you don't have to travel to Israel. The best technology now, there's something called Israeli cow. Israeli cow. Go to YouTube. Who is the current prime minister for? It is Netanyahu. He was talking about it. It produces 72 liters per day for an average of 305 days a year. Yes, 72 liters. It's called the Israeli cow.
Is there someone who has imported such breeds here?
I think many farmers have gone to Israel to see it. But I want the youth to go to Israel tonight.
Okay.
Wachana na WhatsApp, wachana na Facebook.
Or the YouTube.
Enda you have enough bundles. You can even read. Go to YouTube. I want us to be able to, even if we don't go, let's move from the 5 kg to 10 kg. You see, let's improve the economy. And there is no magic in terms of business. I don't want to tell you what I want you to do. I want you to develop interest. Then we can work together as a chamber.
Sure.
Say I want to produce milk. A cow that produces 40 liters. Then as chamber, I can now link you. In fact, we have been having a program called Dairy Value Chain for the last 3 years. It's now going to the next phase. I can link you to the experts. And then you say, yes, your cow is producing 5 liters. In the next 5 years, our target is 40 liters. So that maziwa yetu tunaweka kwa ndege inaenda wapi? Inaenda UK.
Well,
it goes to the US. We are signing now a free trade agreement with the US. It means milk can go easily to the US.
Sure.
So why we not? Those are some of the things we need to export.
So that's a challenge to every one of us. And I think there was a question as I'd ask about your word to the SMEs at the moment. You've really delved into people being creative and also trying to ensure that their businesses are doing well.
Okay.
What can you tell them at this time?
I think, of course, it's a very tough time. And for SMEs, likewise, even for my business. What is unnecessary now, don't do it. major infrastructural developments. If you don't have, you say cash is a king. This is a time to be patient.
Yeah.
But what I would like to tell the SMEs is this: let us innovate. Let us, the client wants an affordable product.
Yeah.
Let us be creative. Let us be innovative. If you are selling a shop, can you get, if you are electrical shop,
Yeah.
if you come to me today as a chamber, I have a contact, because we are not manufacturing
Yeah.
in China, of a company that has 100,000 factories. You tell me, I want this. These are the quantities. Prepare a very nice table on Excel. I'll quote the prices for you in 1 day or 2 days, depending on how I'll get it. So that is one way of efficiency.
Sure.
So that in Ravine or in Kambiamoto or in Kabartonjo, if you are selling electricals, you can be able to. Next time, one of the things that actually made our Gishu chapter to be very successful, we have been able to take 30 youth to China for training every year to go and see what people in China are doing. And out of that, 30 people come, they're able to import directly. So you're able to break the value chain.
Sure.
Next is you are able to go to the factory. It means when you import enough, you can manufacture locally.
Yeah.
You can even assemble locally.
True.
In fact, the story of the gloves I was giving you, the company I was importing from, I told me, you can start packaging in your country. And I'd seen I was going to save a few cents.
True.
So those are some of the things that we need to invest. It's not rocket science.
So
you develop interest, we guide you.
Well, so it's all about innovativeness, and innovation really doesn't mean you're developing something new as a product. You can also be innovative on how you're spending your finances. You could also be innovative in how you are doing your processes as a business. So maybe finally, it's been a conversation about business, the economy, health, COVID. What are your final words, the people who are watching right now and those who would be watching later?
Okay.
Yeah.
We talk about business every time.
Yeah.
That is my subject.
Yeah.
But not everyone can do business. So if you are not good in business, or if you are, I'm saying everyone has. If you've read, there's a book, and I would like to recommend Pandogogy of the Poor, or Changing the Poor Mind.
Yeah.
And there's things about psychology of a human being. They say a human being, or the mind of a human being, it is a poor mind. You have the potential to have a poor mind, to have an average mind, to have a big mind, and to have a great mind. The difference is you choose for yourself
which one you would want to go for.
And we have all those people in the society. So you have been created, you have been given the potential for all of them. To be a useless person and to be a good person. One thing is this, is that I don't want to bring a story of business is good. When I was learning public health, when I was training as a doctor, the issue of toilets for us in Africa was recent. There was a time that people went to dig latrines, pit latrines. Maybe the youth don't know. So what used to happen is that there was a program, a donor program, and a government program. So what would happen is that you would put a latrine, then this person would go and use the side of the latrine. Because there was a belief that if you drop your things down there, then there is something that's going to happen and your body is going to be affected. So I don't want that story of saying that we want to do business and then tomorrow you don't do the action. You go and do the action somewhere else. The action will be much more even destructive. We have spent resources to give you loan and then you go and invest in other things. We have invested time to train you and you go and invest somewhere else. So make sure you invest on the pit latrine. Make sure you do the action at the right place. And it is not rocket science. It is not everyone who will do business. In fact, if everyone does business, it means it becomes very competitive. But the problem we have now is that no one wants to do business. Everyone wants to be employed. Everyone wants to become a government officer. Everyone wants to do the normal things. So we want people to come out of the comfort zone, where let's do professional work, kazi ya mkono kama yangu. Mimi nafanya kazi ya professional work. Hizi stories zingine za kusema, there is a course I asked a young man in the university, that is Jomo Kenyatta University. And it's unfortunate, and I would like to state categorically, even the curriculum developers. It's called procurement and project management. How are you going to manage an engineer if you are not an engineer? It's called project management. These are courses that should be done at a diploma or a master's level. You say procurement and project management. You expose a young person. That person should have gone to study agronomy. After you finish agronomy, you now study procurement. You see? Like in the medical field, there is a course called community health development. That's a course that was preserved for doctors, nurses, clinical officers who have qualified. Because you want to connect development and health. So if you don't have the basic science, but later, I don't know how the education developers in Kenya went. They started from the top, coming down. And I will tell you, if you are in the top of a building, and you are told to climb down, not on the stairs, on the wall, it is easier to climb up and then down. So I think the education system also must change. Well, thank you very much.
Karibu sana. And I think that was a very strong parting shot, and it is an opportunity for every one of us to rethink how we are approaching to issues. You might want to go into business, but are you really committed to do exactly what that business requires you to do so that it can lead to a success? Commitment and being present and taking care of your business every day is what Daktari has really emphasized, based on his experience as a healthcare entrepreneur, and at the same time the vice president for the Chamber of Commerce in Kenya. It's been 2 hours of very in-depth conversation. We expected it to have gone a little bit, maybe within 1 hour or under 1 hour or just after 1 hour, but it has gone into 2 hours, not because we wished, but the content you've really watched for yourself, and a lot of people that have commented, you've been appreciating the content that we've brought you tonight, courtesy of the Daktari Eric Ruto, who is the Vice President for the Kenya Chamber of Commerce. And from us as Baringo News, this is what we have always strived to do, bring you content that will transform your thinking, and also to give you content that will help you to undertake any other process that you are looking at doing in your life. And from us as Baringo News, we really thank you for taking your time to watch this show. It was one which we've always wanted to bring it to you, and we wish to appreciate the presence of Daktari and the Reale group of hospitals that have really supported this program, and also for you is an agronomist, or rather who are specialized in fruit farming. You've seen it for yourself. There's an opportunity for you. Take advantage of it. And for the Reale group of hospitals, you would always want to get your health care kind of services from such people who have gone ahead to invest in quality healthcare services. And from myself, Komen SK, I wish to thank you and to wish you a good night.
For live streaming of church services, weddings, funerals, and corporate events, production of documentaries, advertisements, and its production, contact Baringo News. We also offer public relations services, digital marketing, social media customer care for corporate entities, among other media-related services. For more information, contact Baringo News through 0728 418 165 or through our social media platforms. Facebook is Baringo News, Instagram at Baringo News, Twitter at Baringo News, or send us an email through hello@baringonews.com. Baringo News, humanize your brand. Chebloch Gorge has been in existence since time immemorial. Steel bars installed by colonialists across the rocky gorge presents it as a historical site. At the boundaries of two counties, Baringo County and Elgeyo Marakwet County, it is about 200 meters long and 20 meters deep. This is where one of the longest rivers in Kenya and in the Rift Valley passes through to Lake Turkana, a journey of 4 counties, ensuring food security and water for animals and humans along the way, the Kericho River. Chebloch Gorge has created job opportunities for young dare divers who cheat death in the rocky and crocodile-infested river to entertain tourists and also have fun. Their expertise in diving is also being poached. Chebloch Gorge is only 75 kilometers from the Lake Bogoria Spa and Resort, 15 kilometers from the Rift Valley Hills Resort, and 74 kilometers from Eldoret town. Zuru Baringo, the county of 1,000 scenic views.